How's everyone doing? I don't know if everyone can hear me. Oh, I got thumbs up around the room.
I'm on. I can hear you.
Awesome. Sorry I'm a little bit late. Thank you everyone for joining us on this Be in the Know training. Or I guess it's not even a training, it's just what's going on, overview. So we appreciate everyone for joining us, taking some time out of your busy schedules. On the call, kind of the outline for what we will be doing out of this and what we're trying to accomplish. We'll be starting off with an update from our public health director, Kirk, and then allow him to do an update on what the current health mandate looks like, what his projections are, what's currently going on in the county, and then what he's thinking will happen moving into the following weeks. Open it up for any questions, and then from there, what we would like to hear is from you as businesses and as our stakeholders. Give each of you a few minutes just to do a brief update about what's going on in your area, what's going on with your business. Ultimately, what we would like to be able to do is have that information as a resource to share with our various partners across the state, and for each of you to hear all the way from Monument Valley to Monticello what's going on. So thank you everyone for joining on the call. I do have my staff members. So Allison Yamamoto Sparks is our Visitor Services Director. Aspen Draper is on the call as well. She is our office assistant. And then Stuart Smith, our communication specialist, will likely be joining us too. He's in the office. With that, I will turn the time over to Kirk. And you're muted, Kirk.
I'm always muted.
And then everyone feel free to drop questions in the chat as Kirk's talking, and I can help field some of those questions, and then we will also open it up. But you'll all be muted, just so you know, during this conversation, so we'll be unmuting people as well. Thanks.
Yeah, thank you. And I don't really have any much of a formal presentation. It's been kind of a hectic morning, and I was out of the office yesterday, but happy to discuss, I guess, just general trends. So as you all know, we've seen an increase that's kind of corresponded with a statewide increase. Probably the more, I guess, the most disconcerting aspect of that is just the stress that it puts on hospitals and the number of people who do end up needing to be hospitalized. And so in anticipation of a surge of hospital needs, the state has issued a mask mandate statewide, which I'm supportive of. I think that is a necessary step right now in order to protect those hospitals. Just looking at let me pull some data up here real quick. Just as far as sort of local trends in what we're seeing. There it is.
And if you'd like to share your screen, Kirk, I just made it so that you could as well, if that would be helpful.
Oh, I don't really have too much to share. I may be able to here momentarily. Well, yeah, I can share my screen. Let me pull something up here. How do I share my screen anyway?
Muted. On the bottom of your screen, there's a, in the middle, it's share screen with an upwards arrow. Just click on that.
Okay, let's see. Can you guys see that okay?
Yep, that looks good.
Okay, we can kind of walk through. I'm going to change my view here to just show statistics for San Juan County, and that should update. And so these are the initial spikes that we saw back in May with some of our outreach testing. This is when the nursing home in Blanding was impacted, and we saw a lot of spill out into families. Most of them were really good about quarantining, and you can kind of see what's happened since then. Our results tend to come in sort of waves as people reach out to get tested. Looking at for the subset of people that we're actually able to reach out to and find out when their symptoms started, it looks more like this, more of a stable trend. A lot of people get tested in groups after their symptoms have started. So our current active cases increased the end of October and seem to be somewhat stable as we're looking forward. But primarily what we're seeing now, we've seen a real stabilization in Monticello area, but we are continuing to see increasing tests in Blanding. And I haven't looked at the wastewater data yet today, but just looking at our overall trends for the county, assuming this will pop up. Sometimes it takes a second. There we are. We are looking like we may be at another increase. We thought we were in a lull the end of last week, but perhaps not. The more disturbing thing is maybe our percent positivity of testing has really jumped up and stayed up. We're at about 25% of everyone getting tested being positive. And that tells us that there's a lot more cases that are happening in the community than the number of people that are actually being tested. So there's a lot of people spreading this in the community that haven't gotten tested. So we would expect to continue to see increasing cases until that stabilizes. Looking more closely, I guess, at wastewater, I wish these colors were better. They're not always very representative. Sometimes they don't take into account the most recent testing. But looking at Blanding wastewater, this was early on in August. We kind of have our cases, our known cases out here. We didn't bring wastewater testing on until late July, early August, and things had been fairly stable up until mid-October. And as you can see, we've seen a really dramatic increase. So we fully anticipate there are a number of cases right now in Blanding, most of which probably have not been diagnosed. That's probably all I want to share at this time. Maybe looking back at the state overall maps. This may take a moment to pull up. We're just looking at the last 14 days. This one shows the case rate. So that's the number of active cases per 100,000. And if it pulls up, sometimes it gets stuck on this one. This one would show the rate ratio. So that would be the local rate against the background. So we can see where there were areas of difference, but it may not pull up. Sometimes it gets delayed there. So looking at the last 14 days, overall, things are fairly quiet, I guess, in our corner of the state in comparison to a lot of other areas. And when we look at areas that are seeing significant growth that's outpacing the state average, we're looking at sort of the Richfield area and a lot of areas along the Wasatch Front as being really hot, real hot spots right now. But if we look at the rate, I'm not sure I know what this is. This has changed. This used to be 30 days. Is that still 30 days? Yeah, 10/13 to 11/7, 11/16. The rate per 100,000 people. You can see that statewide, we're seeing pretty significant activity over the last 30 days. Probably not really located in any single area. So that's what has sort of prompted this, hopefully somewhat preemptive lockdown, or not really a lockdown, but a research, I guess, sort of a reiteration of the importance of people staying home and not visiting friends and family right now until we can get this slowed down. We have, if I can pull it up here, this is every day the hospitals in the state report the ICU bed usage and the non-ICU bed usage, and we're on a trend that is unsustainable. If this continues, we're gonna not have enough beds for everybody who needs one. I guess it's just what it boils down to.
Hey, Kirk, a couple questions for you.
Yep.
How is our local hospital capacity? What does that currently look like?
So our local hospital capacity, we don't really have, so neither of our hospitals has a true ICU. And so when we talk about hospital capacity, we're talking about sort of two things. One is just overall hospital capacity. The other is intensive care, the ability to provide sort of sustained intensive care in an intensive care unit. Both of our hospitals don't have an intensive care unit. What we kind of have is a hybrid model in each hospital, where if we bring someone in who needs intensive urgent care, they can patch into remotely to specialists to provide input while they stabilize patients. But generally speaking, the goal of our local hospitals is to get those persons to a specialist, to somewhere that can provide that specialty care. So generally speaking, their preference is to refer those patients out. So as far as hospital beds, we're not using really any hospital beds on any given day for COVID. Very rarely are we having people stay the night who've been diagnosed with COVID to an extent where they would need specialized care. Those people are usually being referred out, and we are hoping to keep the ability to refer people out.
Thanks. Another question we have is, you mentioned that San Juan County is relatively quiet compared to the rest of the state. Is that quiet due to lack of testing?
It could be due to lack of testing, particularly right now in Blanding. I think that we're seeing testing rates that don't really correspond with the percent positive or the wastewater. So there, that could be twofold. We could have a lot of younger people who maybe have very mild symptoms or are asymptomatic, or we could also have people that have symptoms that are just opting not to get tested. And that hampers our ability to really know what's going on, other than we do know that with a high percent positivity like that there are a number of cases in the community that we're not aware of.
With the upcoming holiday season, what are the health department's recommendations where the governor's mandate ends on November 23rd?
Yeah, I know that's really tough. I think right now, I think would not be a good time for people to get together with extended family. We would probably be recommending that people try to do Thanksgiving within their household and not have extended family get-togethers at this time, especially if those get-togethers might include people who are in higher risk populations. I think that would be a significant risk to those people. We'll be sending out a mailer, I think, should be showing up in people's PO boxes shortly, that sort of emphasizes that, but does also provide you with steps you can take to try to make get-togethers more safe. But I would hate for anyone to think that we were saying it was okay to get together. We're happy to give you guys give people tips on what they can do to try to have their get-togethers be more safe. But right now, I think recognize that could represent a significant threat to people that are more vulnerable to this disease.
So I think this is the mailer that Kirk is referring to that you should be seeing in your PO boxes coming out.
Yeah.
Sorry, I'm grabbing some questions on I'm getting both general questions and private chat questions. Let's see. There's a question about an update on vaccinations. There was also a response. The governor is having a press release on vaccination distribution tomorrow, but did you have any additional insight for San Juan County?
I don't really have any insight yet. There should be a first few doses that are going to be available to long-term care facilities. I don't know much more than that. We're waiting for more information. Well, I guess we'll see how that plays out, but certainly we're looking forward to a vaccine and hope we can be in a position to distribute that. But the first couple of doses that are going to be made available are going to be earmarked for long-term care facilities and long-term care facility staff, is my understanding.
Do you anticipate any changes to the governor's mandate after it expires on November 23rd? If there are changes, what will San Juan County Public Health do? Will they follow this state?
Yeah, we'll probably follow with the state. I don't anticipate we would ever do anything different. The fact of the matter is that we rely on state resources as much as anybody, state ICU beds. The majority of people that get flown out of our hospitals end up in Provo, St. George, St. Mary's, or somewhere on the Wasatch Front. And all of those hospitals are currently pretty strained. The issue that we really have when it comes to hospital beds is that it's a lagging indicator. So most of the people who need a hospital bed don't need it until the 10th day of their symptoms. So hospital beds lag a couple of weeks, a week and a half or so behind cases. So when we see an increase in cases, we know that we're going to see an increase in hospital beds, generally speaking. And there may be some nuance to that because you might have an outbreak in high school age kids or in college kids where a much smaller percent will end up hospitalized. But overall, you can generally assume when you see spikes in cases that spikes in hospital bed utilization will increase, 7 to 14 days after that. And so I think that the governor, I know the state epidemiologist and our epidemiologists will be watching our trends to see if we feel like the increased vigilance message impacts cases. If it impacts cases dramatically, then I would anticipate the governor wanting to let that temporary mask mandate, I don't know how they would want to approach that. It probably depends on if they actually make a huge dent or a moderate dent. But if cases continue to rise, then I would think that we may have to even do something more extreme in order to be able to prevent doctors in ICUs from having to turn people away, which is our goal.
Thanks. The next question is in regards to enforcement of masks. I don't know if you wanted to double team that with me on the Labor Commission overview for business owners and what to expect from that.
Yeah, I don't really have the staff or the bandwidth right now to get into much enforcement. And that was a conversation that we had at the state level. Most of the health departments felt pretty strained. And we urged the state come up with a state solution for enforcement if they felt it was necessary. And they indicated that the Labor Commission would be issuing fines to businesses that were non-compliant. I don't know what that will look like per se. I do know that they've shared with the public sort of whistleblower site where you can report businesses that aren't you can report businesses where employees aren't wearing masks. And I don't know exactly what that will look like or how that will go, but we didn't feel like we had the bandwidth to be sparing any staff right now to be out trying to police this. We wanted to focus on good messaging, making, kind of twofold, helping businesses know what they can do to protect their staff, helping individuals know what they can do to protect themselves or vulnerable loved ones, and monitoring trends and reaching out to every contact to give them good information so they know what to watch for, what warning signs might be, and how they can protect loved ones. So we really want to be focused locally right now on reaching out to the cases and giving them good information, and we didn't want to be out trying to police and spreading our staff thin. So I guess that's sort of where we're at.
I mean, talking to you and to Kendall about that element, I know that that's a question that's on a lot of business owners' minds. With the mandate that the governor rolled out, the Utah Labor Commission's Division of Occupational Safety and Health Standards issued an emergency rule that requires all businesses and employers and employees wear masks. The rule is specific to employers and employees. It's not, it does not take into account businesses requiring patrons to wear masks. So as individuals or as whistleblowers, so to speak, the term, report anything that they see throughout our county on county businesses, they're reporting specific regarding to employees or employers not wearing masks, not that the business is requiring that their patrons wear masks.
Right, and I think in the state order, it does ask businesses to provide reminders to your patrons. But I know something at the state level that they really didn't want any business to feel like you had to confront patrons who were blatantly not going to wear masks or were confrontational. Nobody wanted to try to put businesses in a position where you felt like you had to enforce mask wearing on belligerent patrons or whatever it might be. So I think that was very carefully thought through as they sent that out. They want you guys to your only duty is to provide information to patrons and ensure that your staff set an example.
And I would just take that time to do a plug for the San Juan Strong Promise, that any businesses that signed on to that, we do have material for you to post in your businesses regarding requirements for mask wearing and also recommendations for how business employees can stay safe, and then how visitors and customers can stay safe as well, and that's in collaboration with the San Juan. Let's see. Question: do you have any communication with the Navajo Nation and any insight on what their 3-week curfew?
I didn't make it on my call with them this week, so I don't really have any additional insight. I know that they're seeing a surge across the Navajo Nation as well right now, and I anticipate there will be attempts to increase vigilance and perhaps I don't know what they might be planning to try to attempt to address that, but they have seen a resurgence as well.
Is site-specific sewage testing being done? For example, can you pull sewage from a specific location, such as a high school or from a business?
No, right now, that's just too labor intensive for the water quality team, I think. They've done that at a few locations on the Wasatch Front that are closer. They've done some specific campuses. And we had talked early on about the possibility of doing a wastewater collection that would have captured the USU campus area as a distinct area here, but it didn't really seem that feasible given the layout, I guess, of the sewer system there. Otherwise, no, we're just catching effluent basically where it would flow. The last stretch before it would go under the sewer pond in Monticello or Blanding. So what we're capturing is just sort of a snapshot of that entire community that's on the city sewer. Of course, we're not able to understand anything about anybody that might be on septic systems. We're only aware of what's flowing into the sewer.
What can you say about people that feel like they had the virus back in February and March? What about antibody tests?
In this area, that's probably not the case. We've heard that a lot. Lots of people have said that they had it in February, March. And in fact, Blue Mountain Hospital had several employees that were adamant that they had already had this in February. Blue Mountain tested all of their hospital employees in May, and no one had any antibodies yet. San Juan followed suit in, I think, early June. And amongst all the staff at both hospitals, which was over 150 people total, there wasn't a single person at that time that had antibodies. That's a pretty good indicator that it did not come through this area back in February or March. We definitely saw some respiratory virus spread. I know my son was very sick with something that was not influenza in February. But based on what we've seen with antibody testing, I would say it's very unlikely that anyone in this community had COVID prior to April, May. We've seen a lot of positive antibody testing since then, but the vast majority of positive antibody test results that I've seen were people that resided in Monument Valley, Navajo Mountain, Montezuma Creek. We've seen very limited people test positive in Blanding and Monticello. Until just recently, we've started to see positive antibody tests in those communities.
Oh, thanks, Christian. So in regard to the USU campus, they've been running tests on the USU Blanding campus for 6 weeks. They've been clean except for 1 week. They were trying to show very, very low results of the 4 gene copies per million. Question from someone else. With COVID rates increasing, is the death rate lower? What does that look like compared to in San Juan?
Yeah, Utah's death rate has been lower since the beginning overall, and our death rate continues to sort of defy what we're seeing in other states, where our case rate while our case rate has climbed, our death rate has not. I suspect that that's partly due to the fact that our case increases have been primarily amongst people under about 25, and we've seen significant spread in like the 14 to 25-year-old range. And I'm speaking now statewide. That's not necessarily what we're seeing locally, but as a state, the bulk of the new tests have been in younger population. As long as those people are able to quarantine effectively and prevent spread to additional households, maybe we'll continue to have a lower death rate. But if that continues to spread out into the community, which is what we've seen both locally and other places in the state and nationwide, is that often spread in these under 25-year-olds precedes spread in the general population. And so I think we're all worried that we'll start to see older adults get impacted at significant rates that might exacerbate the death rate locally.
Thanks, Kurt. Any other questions? Maybe what we'll do is do the roundtable, but give some time. So we'll start at our community stakeholder level and then work our way to the business level, if that works for everyone. So let's see here. We have Chris Hansen on from State Parks. Chris, put you on the spot. Did you have any updates you'd like to provide with the group? To the group? You're on mute. I'll come back to you. Let's see, Christian Elson with USU Blanding. Christian, you've been making a few comments in the chat as well, so I'll let you highlight those comments as well.
Yeah, first of all, Kirk, I sure appreciate you and your leadership in the county. I think you've been doing an outstanding job. On the campus here, we've been, as you may have seen in the chat, we've been pulling wastewater from 2 locations on campus that isolate our 2 residence halls. And up until this last week, we've had 0 results. And then this last week, we showed 4 gene copies per million, which quite frankly could be a sampling error. But it's pretty dang low. So we've been really lucky to dodge a bullet and haven't had anything on campus. The big news is per the governor's new COVID-19 strategy, we will begin testing students this coming Thursday. So this coming Thursday, any students locally or that travel to Blanding to take classes in person or live in the residence halls will be required to get testing. We'll be doing testing weekly for the foreseeable future, and then be able to take the appropriate results with those individuals to isolate anybody that tests positive from the results of those. Right now, the tests are reserved for our students per the governor's request, though if employees come to us and ask if they could be tested, we're not going to tell them no. We're not going to open testing up to the community. We just don't have enough tests available to be able to open it up to the community. And so I apologize for that, but we have a limited number of tests based upon our student numbers. And those tests for the students will be free. They are the rapid result tests, so they'll get test results within about 15 minutes. It's a nasal swab, though it's not as intrusive. It's just at the front of your nasal. It doesn't go all the way up. And our nursing students, our CNA students are going to be helping us out quite a bit. So we're excited to get that up and running on Thursday. And we'll see what happens with the results. And I'll make sure to share those if anybody's interested. We can't share individual data, obviously, but I could share, our percentage. I'll obviously be sharing that with Kirk. But if you're personally interested, there's no reason why we wouldn't share that. Utah State does publish the data currently on its website. You can just Google USU COVID and you can see. Right now, we're the only location that doesn't have any active cases for USU. So we feel pretty good about that. And again, I think Kirk's done a really good job with his aggressive quarantining strategy and getting people isolated. And we've had some of our students affected by that. We've had a few students test positive, not on campus. They've been in other communities around the county and they've been quarantined. We had one poor student that she was at day 14 when she tested positive. So then she had to quarantine for COVID. So she was in quarantine for like 24, 25 days. So yeah. She just barely got out of that. So we're doing okay. So.
Well, thanks, Christian. I really appreciate those kind words. It's nice to know that some people recognize what we're doing. It's been helpful. And I hadn't seen the wastewater. I thought that they were going to include me on those results, but I hadn't seen that. So I didn't know if it was up and running yet, but glad to know you guys are doing that.
Yeah, my bad, Kirk. Sorry, I didn't get that to you.
Oh, no worries. No worries. I kind of thought that it was going to be shared at a higher level. So no worries. We can coordinate on that in the future. And just so people are aware, this newer rapid test that will be out there, this nasal swab, this is an antigen test, and it's really quite a different beast from the PCR assays that we've been doing at the state lab. If you're doing a PCR test on an individual, you may be able to test positive, detect virus a couple of days before a person gets symptoms. And then, for 2 or 3 weeks, even after those symptoms have resolved, a lot of times they'll continue to test positive. And that's a big window. And so even if somebody delays getting tested for a whole week, until they're starting to maybe feel a little better, and then they say, oh, I've been sick for a week, I should go get tested, they'll still show positive on that. And you should just be aware, Christian, that those antigen tests are very, very different. And essentially, those are going to only be positive typically in the window when the person's most infectious. And so you're only really going to be able to tell that a person is positive for about a 3 or 4 day window when they're most infectious to other people. But if they delay testing, if they're sick for 2 or 3 days and then they get tested, probably going to miss it on that assay. So it's not a great assay for like ruling out disease and saying, oh, you definitely don't have COVID. That really isn't what it means. But it is a good assay to say, are you currently infectious to other people? You're probably going to be positive on that test if you're currently potentially infectious. And so, you know, just being aware that, I guess, that nuance in testing, that testing weekly to see if people are infectious essentially is really valuable. But it may not directly sort of, it's not an apples to apples comparison to the other testing that we're doing that might be able to detect more asymptomatic cases or more cases that may be delayed testing. Just to kind of be aware of that and understand maybe the nuance of that and be able to explain that to students that do get tested, that, you know, there's a good test. You'll be positive if you're currently sort of infectious to others, but it doesn't mean that you didn't have it for the last 3 days and now you're starting to feel better. So anyway, just sort of something to be aware of, I guess.
That's good to know. And somebody asked if we're going to be testing concurrent enrollment students. We're not going to be testing concurrent enrollment students at this time. So.
Thanks, Christian. Since we're on USU, Megan, I don't know if you have any updates for any of the business owners on the call with the Small Business Development Center. You are muted.
I don't have a lot of very specific updates. We do have a COVID-specific business consultant that is an expert on like the PPP loans and the forgiveness and all of those things, who's now assigned directly to San Juan County and Grand County exclusively. She will be working in our area for the next 2 weeks to possibly month, depending on how long training is. So she is working out of our SBDC here in San Juan County. So if you have any of those loans, have any questions about the forgiveness side, things like that, feel free to set an appointment with us and we can go over those aspects with you, as well as she'll be working with us through September of 2021. And so if there is a new HEROES stimulation or anything like that that gets passed after the first of the year, she will be going over that and making sure she knows the ins and outs of that as well. So that's just kind of the update from our end for the business owners.
Great, thanks. Chris, we had an update, and then Megan, if you would be able to drop your information for the group in the chat, and then we can follow up too with any contact information for anyone that would like.
Oh, definitely. Also, we are currently filling out grants and stuff like that for programming and to help overcome and get back to business. And so if you could fill out that survey that went out on the newsletter today, that would help us drastically fill out those grants and help us with programming, because we want to do that at a level that business owners can do it and hopefully not have to pay the expensive costs and things like that too, because we know that that's important too. So filling out that survey really helps us out as well.
Great. Thanks, Megan. Chris Hansen's update from Goosenecks and Edge of the Cedars State Park. The main news of late is that they are wrapping up a $14,300 Utah Humanities Cares grant and will be completing a $19,400 NEH Cares grant as well. These grants have allowed them to do some exhibit improvement, buy some curatorial supplies, and hired 2 contractor curators to do a tremendous amount of work on our curatorial backlog. At Goosenecks, they submitted their application for the International Dark Sky status, and they had a lot of great support from local community leaders. So thank you to everyone that supported that effort from the state parks. The numbers that they've been seeing somewhat normal numbers until about 2 weeks ago. Then those numbers started to drop off, which is pretty standard for them at the state parks. Let me see if I have any other, let's see, Blanding City, Pratt and Kim, I don't know if you two want to tag team any updates that you have from the city. You're muted.
I can go. I didn't see that Kim was on here, so.
Go ahead, Pratt.
All right, thanks. If I forget anything, you can fill me in. Currently, the city's just following the same protocols that the governor has asked us to follow, as well as the county. So we have, when we're close in proximity, even with our coworkers, anyone from the public, we are wearing masks. Just trying to keep that from spreading. Blanding City is a small organization, so if 1 or 2 of us were to get it in the office, we would be not in a good situation. So that's where we're at. The city stands by and supports everyone that is trying their hardest. We know that some people definitely don't feel or agree that masks are appropriate or needed, but for right now, Blanding City absolutely supports what's going on in the county and the state, and is trying our best to keep our citizens safe.
Thanks, Pratt. Let's see, we did have Ann on here from Bluff, but it looks like she dropped off. Maybe Jen, can I turn it over to you from the business owners of Bluff to do a quick update?
Sure. We, like Chris, are, of course, seeing our end of the season slow down. Cottonwood Steakhouse is closed. I think Comb Ridge is getting about ready to close. Twin Rocks has gone back to a more winter type menu. We'll have San Juan River Kitchen opening for restaurants here, I believe, sometime next week. So business in Bluff is slowing down as the season wraps up. COVID wise, I mean, we've all, as a town in Bluff, we've had a mask mandate for longer than the governor has initiated it. We're all trying really hard to keep everybody here in town safe and keep our guests safe as well. I think that this is being successful. If you look at the numbers for our vicinity, they've remained pretty low. So, we're just trying to keep everybody safe, and so far it seems like it's working well for us.
Great, thank you. I think that's all of the stakeholders that I see right now on the call. I'm just going to start going down the line. We have a few businesses on, so maybe Monica, do you want to start with Gouldings and let us any updates that you might have for the group?
Can you hear me?
Now we can.
Okay. We're the same also, Monument Valley for Gouldings. We've never released the mandates of mask. So we've stayed with that throughout since I think March. So we're not going to release that mandate. So everybody here is required to wear a mask. We've asked our partners also to come in and wear too. So our patrons are wearing them. So we haven't had problems with tourism either. They've been due diligence and really responsive to all of the requirements here. Not sure, we've seen a little bit of an uptick, but now that the Navajo Nation has gone down to a lockdown, we see it now also depleting. The reservations are all getting canceled because they think that there is another roadblock. So I don't know how to go across telling the consumers that the roads are not closed. Kurt, I'm not sure what the feeling is for tourism. I mean, is that something that the state is asking also to not have the tourists come through here?
No, I don't think that we've really, at this point, clamped down on tourism like we did early on when when we weren't sure what we were expecting, we really tried to slow tourism. I think now there's a real recognition that we're not seeing a huge amount of spread at businesses, particularly at businesses where mask use is encouraged or required. It seems to be that maintaining social distancing, enhanced sanitation, and mask use has been pretty protective in the business settings. What's driving spread statewide right now and in our community is family gatherings, social get-togethers, friends coming over, kids sleeping over at other people's homes, people getting together for Halloween parties, that sort of stuff. We also are seeing quite a bit of spread in extracurricular activities where mask use isn't really possible. So when, sort of sporting type events where people maybe have to remove the masks in order to participate in a sport and then haven't been very good about putting those masks back on when they go into locker rooms and that kind of thing. That's sort of what we've been seeing locally. So I don't think that there's yet been any sort of push to try to slow businesses or slow tourism yet. Certainly, I think that may be on the table if our trends continue to skyrocket the way they have been.
Yeah, then that's pretty much where we're at then. I mean, we've done everything we can. We're not going to let go of the mask mandates here because we do feel that it does help the community and then the surroundings of where they're going. So I don't know what winter's going to look like for tourism unless this vaccine comes out, and then not sure how that even takes a play on the economics for San Juan County.
Thanks, Monica. Let's see, Jim Hook, do you have any updates?
Hello, thanks for putting this together for us again. It's always good to see friends and neighbors out there all in the same bag. We had a bit of an uptake there in October when our fall folks wanted to come out, and that was nice, kind of gave us a little boost. Having the Navajo Nation president show up on CNN reporting 3 weeks down, that was a killer. Between New Mexico requiring 2-week quarantine if you come into our area, Colorado numbers really going up a lot higher than Utah. The negative thing is just here. You couldn't buy negative press as bad as we've had in the Four Corners country. So I think the further south you are in the county, the heavier the impact has been. We're still looking probably 70 to 80% below what we were last year on income. And it's fine. I mean, we're working along. It's been a beautiful fall, although it's really dry everywhere. And I'm not looking forward to winter.
Yeah, I think what we're hearing is 3 back-to-back winters for our tourism businesses. Is what they'll be experiencing. Thanks for
and then the European market for next year really doesn't look good at all either. They're still, well, we're not far enough through the thing for anybody to make any plans. And even people who are planning for next year, it's with a grain of salt. We don't believe it and they don't either till we get there, but on we go.
Correct. Thanks, Jim. Appreciate you joining us. I question, this might be for you, Monica. Are Canta gas stations open on the weekend when the tribe is put on lockdown?
I was told they are not. I'm not too sure about the credit card part. I will find out and I'll get back with you today. Typically when he does that, that causes us to become the roadside assistance. Last time he shut down gas stations, Waylon and myself loaded up 5-gallon gas cans and drove around everywhere and tried to help the tourists to get from point A to point B. I drove in yesterday from Phoenix. I had a meeting over there, and yeah, it was, I saw a bunch of truckers in the Cameron area where the Burger King is, the roundabout, and they were all on the side, so I'm not too sure if they were able to get gas. So I can find out, let you know, and then you can let everybody else know what we find. But there is no roadblocks. Waylon was out there last night. He did talk to the sergeant. It told him that because typically, well, we are. Goldings is the essential center even for Cayenta. When the president does this, we have all the medical, the fire, the police, everything that you could think of come here and utilize gas to get something to eat, and they go back on patrol. So it's very hard to try to figure out what is right and what's wrong, but as long as we're concerned, the mask and keeping the mandates is what we're going to stay with.
Natalie, can I speak to that as well? I drove back, my in-laws live in Snowflake, and we drove back 2-3 weeks ago on Sunday, and the only gas station that had across that side of the reservation that had their pumps on and allowing cards was Mexican Water. Ganado, Chinle, Round Rock, all of that was shut down. So I don't know if that helps at all, but that side of Arizona was shut down.
Thanks, Pratt. Thank you, Monica. Appreciate those updates. I'm gonna, let's see, Heidi Harris, we have you next. So out of Monticello, in at the Canyons.
Hello, everyone. Yeah, so in at the Canyons in Monticello, yes, we had an uptick also in October and this November. We were supposed to do a big remodeling project last spring and it fell through. So that's kind of what's keeping us going, is just the reserves that we fortunately had. We're kind of talking about people passing through, and I just got an email from a guest that wants to cancel their reservation because all of the places they had hoped to visit are not available. So I don't know what they're referring to. So this is kind of interesting to see. Maybe I'll ask the guest. I'm the one that asked about the antibodies testing because it's cost us so much money to pay for employees to be out. We kind of just did it as a moral decision. Not only that, but we have to pay all the other employees overtime to cover these shifts. And so I'm just trying to anticipate if there will be more people that are going to be missing work and what that's going to look like for us. And, you know, even myself as an owner, am I going to get this? I felt like I was very, very sick in March, but because I didn't have a fever, they never tested me. And so I'm just wondering if the antibodies test would just be able to give me some clarity going forward as a business owner. If I get, sick, I guess it's just kind of eliminating who could potentially cover the front desk. That was kind of my concern. And yeah, I think that's all, unless anybody has a specific question about business in Monticello.
Kurt, did you want to respond to Heidi on those questions?
On the antibody portion? Yeah, I like I said, I think it's probably unlikely that you would have had it back then, but certainly it's something you could talk to your doctor about. I don't know if it would be covered by insurance, so that might be a conversation to have with your doctor. But I have seen mixed evidence. I don't know if there's a consensus yet on how reliable antibody testing is long-term. And it's important to know that antibodies circulating in your blood don't necessarily mean that you haven't been exposed. For some types of diseases, you may have antibodies that circulate for a set amount of time. They might be detectable for weeks or years, but even when those antibodies drop off, you still have memory B cells that can ramp up an immune response very quickly. You still might be, you still might have some sort of immunity. I've seen mixed information about the longevity of antibody testing. I would definitely talk to your doctor if that's something that you're interested in, and weigh the pros and cons of that. we just don't know enough. There just haven't been enough studies done on people who were infected more than 3 or 4 months ago for us to understand how long a person might continue to be able to detect antibodies in their blood with any real sense of surety. So I guess bear that in mind as you think about antibody testing.
Thanks, Kirk and Heidi. Appreciate that. Rick Reef with Cottonwood Steakhouse.
Yeah, as Jennifer said, we're closed for the season, so don't know too much what's going on out there, except we're closed. I'm hoping, as Jim said and Jennifer, that in March when we open back up, it'll be as good as it was in September and October. We're hoping that we see some business incline there as the Americans start to come back for their usual spring break activities, which is what we usually see in Bluff, but based on where we are now, who knows if that'll even happen. So not really too sure.
Thanks, Rick. Let's see. Lewis Williams. We'll loop back to some of these individuals if we don't hear. Amanda Podmore. Andrea Martin. Let's see. Kate. Thanks, Kate. And Keisha Jute. Sorry if I mispronounced your name.
No, let's see. Can you hear me?
Yep, we can hear you.
Hi. Sorry, I'm in my utility closet. So no, I mean, we just opened just a month ago, so it was busy for us, but we just closed, so we haven't really seen the effects of it right now.
And then Keisha, do you just want to let everyone know you're with Glamping Canyonland, so a new asset that's opened up for us in San Juan County?
Yeah, so we just opened up a little campground down at Highway 211, just the entrance to Canyonlands National Park, the Needles area. So we have 3 tents right now. They're all fully furnished. And I just actually am in my utility closet because we just put up a booster, and it's the only place I can get Wi-Fi. So yeah, sorry about the mess, but yeah, we just opened. So, and then we just closed for the season.
Awesome. Well, thanks for joining. If there aren't any other updates from anyone, Stuart, I'll just let you do an update on the San Juan Strong Promise, and then we'll go from there.
Muting. Well, we are seeing a little bit of pickup in participation in the San Juan Strong Promise. It's the fact that the governor finally came out and said people need masks. The businesses are putting up mask required signs, but a lot of the questions, you know, and I asked mine and you communicated it, it's regarding enforcement. I am encouraged by the fact that most of the responsible businesses are doing the right thing. I wish, I mean, it looks to me like Bluff is completely compliant, or for the most part compliant, and we seem to get a little less compliant as we move north. I would love to see that change. And I'll be there to distribute it if it does. So there we go.
So I don't know if everyone has that resource. If you go to utahscanyonCountry.com/San Juan Strong Promise, there's information there on how to join the promise. You simply click on the Take the Pledge link, and then it walks you through a few steps. It's for any type of business, and then it's ultimately reviewed by Kirk at the health department, and then approved by him. You receive a certificate, and then from there you're kind of entered into this pipeline of additional resources for you as a business owner as you're going through COVID-19. Regardless, feel free to reach out to our office if you have any questions as a business moving forward. But with that, I guess it's 2 o'clock now, so we'll close that. What we'll probably do is shoot out a survey to all the participants and everyone to see what other topics you'd like to cover. I think there's some pretty specific COVID-19 topics that we can address, whether it be through the Labor Commission questions or whether it be through employment. But we'd like to continue this conversation, and it's great to see everyone's faces and to get updates from business owners during this time. Jim, did you have something? Sorry. Oh, you're waving. Well, thank you everyone for joining. We appreciate it. We recorded this as well for future reference, so we'll send that recording out as well. Thanks everyone. Have a great day.